My name is Nicholas Kelbeck. I've worked here for 16 years. I am the adult clinical educator at Brigham and Women's Hospital. We're using the Hamilton G5 in our ICUs, the MR1 in our MRI, and also the T1s for patient travels. After comparing Hamilton alongside other ventilators out there, the comparison wasn't even close. Hamilton offers so many specialized features that other vents cannot offer us and has really helped us with patient care. They have the IntelliCuff, which gives us continuous monitoring of cuff pressures. We also have the end-tidal capnography built right into the screen where we can even see a waveform with it. It also has the pneumatic nebulizer, which we can run single dose or continuous. The ventilator also has a PV tool, which is great for our PEEP monitoring, and we also have the ability to do ASV. It's no competition. Hamilton is the best for ventilation.